Hi, my name's Minhal.
My name is Carl.
And Carl, what are we discussing today?
Oh man, we're talking about a bit about electrotherapy today.
Yeah, your favourite one.
My favourite one. I don't know about that. I think you're more your favourite. But so what have we got here then, man?
So we're going to discuss two different machines here. So we've got the Shockwave machine here, and we've got the Electrotherapy machine, which consists of two treatment modalities: Interferential and Ultrasound.
Oof, Shockwave and electrotherapy. Sounds.
Yeah. Do you use any of these?
Do I use any of these?
Yeah.
Yeah, now and then I use the Shockwave quite regularly, and I do tend to use the ultrasound or the kind of interferential now and then when I see it's appropriate and I've got the time.
Fine. Let's start with ultrasound. So, what is ultrasound?
Oh, okay, fine. So ultrasound basically it uses sound waves to kind of promote blood flow to the kind of injured soft tissue, and basically kind of help speed up the kind of injury. I tend to use it on injuries that tend to be a little bit more sort of fresher or acuter, as we say. When there's a lot of swelling, it tends to show kind of quite good effects. And yourself, Min? What about yourself?
I'll be honest with you, I don't tend to use it too much. If I do use it, as I said, I use it during the early stage of an injury, as it promotes, quicker healing process, decreases with swelling a bit. So that's the only reason why I tend to use it. I'll use it on pathologies like an ankle sprain or an early muscle tear. I think I use it for that, but I don't tend to use it too much because I always get the question from patients, is the machine even on?
Yeah, you can't really feel much when you're having this treatment.
Is the machine on? I can't feel anything. So what I normally do is when I turn it on, there's a green light that comes on here. I make sure they see the green light so they know it's on. So I try to avoid that question. But I don't tend to use it too much, to be honest.
That's fine. I mean, like I said, really, when there's a lot of swelling, that's when it tends to be at its best use. I mean, like if you've only got a short amount of time, there's other treatments that could probably be a little bit more effective. Wouldn't you say?
Yeah, it's fine. And also the evidence behind it, there's not a lot of strong evidence behind it to do it on certain injuries. Some patients are aware of this, so they come to seem to also say that, I went to practice, I only use ultrasound. So sometimes, it can get a bit tedious for patients. But yeah,
I do tend to find I get a lot of patients that request it a lot, though, if that makes sense. So they go and tell me, my PT told me to go and get some ultrasound. So I'm like, oh.
When they get referred, that's fine.
Yeah.
Fine. So next, what about interferential? What's interferential?
So interferential basically kind of uses kind of electrical waves to kind of distract the pain. So when like kind of nerve endings are kind of all excited and they're kind of emitting pain, kind of like these electrical signals kind of help distract from the pain, help calm them down basically. So again, it's really good for when there's like really high levels of pain. And it's really affecting, say, your function or your daily kind of tasks. So you put it on for about 10 to 20 minutes, and it can really help reduce those kind of pain levels down.
What do you feel?
A lot of tingling, really. A lot of tingling. It's unusual, but nice. I always find. Yeah.
Should we give it a go?
Yeah. So why do we have these sponges then, and why have you just wet them?
Basically, it's actually funny. So a patient always asks me, what is interferential? I normally say to them this. You've seen the movie called The Green Mile?
Yeah, where are you going with this, man?
So, if you guys have seen the movie called The Green Mile, you can see that the guy unfortunately gets electrocuted at the end. But the reason why he gets electrocuted is because the sponges aren't wet. So I've wet the sponges.
So what you're doing is you're putting a device that could electrocute me, but because of the wet sponges, I'm going to be okay, yeah?
I'm your mate, don't worry.
Oh, thanks, man. I appreciate that.
So
what are you going to do to me?
Hold on to these pads.
Will do.
Okay, so I'm just going to turn it on, and you can just tell us what it feels like. So let me go to two-pole. There you go. So
don't turn it up too much, like you did in university.
Yeah. Oh yeah, that was a funny one during the exam as well.
During the exam, he switched it up really high. My hand went into full-on contraction. All right. So yeah, I can start to feel some tingles now.
Okay. So what does the sensation feel like?
Yeah, it's
pins and needles.
Pins and needly.
Ants running around.
Yeah, ants running around. That's a really good one. Like kind of like all watery at times. It's there's a nice feeling in a way.
Yeah.
But if you get it too high, it can become like a little bit sharp and stingy.
Increase it or keep going?
I'd say it's a nice little level. So once you find that nice little level, we tend to keep it on there. But then after a little while, you'll kind of get used to it. So then you can take it back up again.
Yeah.
So.
I think patients like that at the end of treatment because, you know, once you've used your hands to get into them and they're a bit more inflamed, you can use that just to calm everything down. It feels like a feel-good factor as well.
Do patients say to you it feels like one of those like ab machines?
Yeah, they do. Well, no, they ask, is it one of these ab machines? Because they do tend to ask, can you put these on my stomach to get my abs? I say,
Did they actually ask you that?
Yeah.
Oh.
I actually say it's a different concept. So,
Well, you can turn it up now.
you got used to it.
Yeah, used to, you see.
So, it's not for the ab machines. This specific setting and concept, and it's not.
But you can put it on the tummy though if you've got a little bit of abdominal pain.
But it won't get you abs.
No.
Okay.
Damn.
All right. So, stop there.
That's it. Perfect.
Oh, cool. We normally put this on for about, I don't know, I normally put it on for about 7 to 10 minutes. Depending on how much time we've got left in the treatment. And then, yeah, that's really it.
Perfect.
Yeah. All right, I'll turn this one off. I'll take that. So, let's move on to this big boy. What is this?
So this,
I need
my
to
friend,
break
is yeah. Don't break this machine, please don't. Is a this is a Shockwave machine, and this is the Shockwave gun. This intimidating object, we'll say. So, Min, what kind of injuries do you tend to use this for?
So, shockwaves normally used, well, it's, I wouldn't say it's a new treatment. It's been around for a little while, but the evidence has actually grown quite well over the last couple of years. So, shockwave is used for any chronic tendon problem.
So what kind of tendons would you say? Well, like which ones do you hear of a lot?
Tennis elbow, Achilles tendinopathy, patella tendonitis, hamstring tendon strain, anything like that. What it kind of does is you use the machine. Obviously, it's not. We'll demonstrate in a second, but it kind of brings the problem back down to an early stage of an injury, so it's easier to heal from that early stage.
Yeah, so I think it again uses sound waves a bit like the ultrasound, but at a lot higher pressure. So in a way, it potentially causes a little bit of trauma to kind of help that restart that healing process. Again, when injuries have been going on for a little while, that, how can I put it, that injury has been, that kind of healing phase is stopped, but it's still painful, so this kind of restarts it.
Yeah, so patients ask me, what is shockwave? I say to them, okay, so imagine you've got a brick wall, okay? If I punch that brick wall, yes, I know my hand will probably break, but eventually the brick wall will go down, eventually, after a long period of time. This is when you have a chronic problem. If I use shockwave, it's like using a power drill, and it'll break the brick wall down immediately. And then it brings it back to an early stage, so you can rebuild the brick wall back up the way you want to rebuild it back up.
That's pretty good.
That's how I normally describe it.
It's a pretty good metaphor.
They ask me, is it painful? I say, it's not pleasant, but you can tolerate it. So we'll see how much Carl can tolerate it in a second.
So, what are we going to be shockwaving them in?
So what I'm going to do is I'm going to shockwave the soft tissue that attaches just onto your bone at your elbow bone here.
So where the tendon kind of meets onto the bone, yeah?
Yeah, not the most pleasant place, but we'll see how it goes.
Not at all.
So just so the audience the viewers can hear it.
One more time.
Okay, so this is going to blast his arm. Obviously he has no problem, but we're just demonstrating. So,
please
ready?
don't blast my arm.
1, 2, 3. You okay?
I'm fine, I'm good.
You can tolerate that?
Can
we go a bit stronger? Let's see.
You can go a little bit stronger.
So we'll go to a little bit stronger. You see the difference in sound when you go a bit stronger? It's a bit quicker.
Well, that's the spot.
So you can see there's a little metal head here, and if you imagine that just hitting you a lot of times in the space of a short period of time, so it can be it can cause a bit of discomfort.
Yeah, generally, like, it's the first 5 seconds tend to be the most discomforting, especially when it hits that kind of sensitive or that kind of injured area. But give it about 5 seconds or so, you kind of get used to it, and then it should be okay afterwards. Some people, depending on the kind of severity of the injury, it can last a little bit more and it can be a little bit more discomforting, also depending on your kind of pain tolerance as well. But generally the treatment only it can last up to about 1 to 2 minutes, depending on the kind of intensity that you have it. Sometimes it can last a little bit longer, to 5 to 10 minutes, if you're struggling to tolerate it, or if you just got it at a lower intensity.
What's this?
Whoa. So this is like these kind of famous massage guns that you kind of see on social media these days. Personally, I don't tend to use it very much. I tend to use my hands more than anything else. But I mean, like, some practitioners or some physios or chiropractors might use this little gun like so. So you literally can apply it to the kind of tense tissue or tense muscle. Find a little tender spot, hold into it for a little bit longer. You can feel that, can't you, Min?
Sounds like revenge there.
Oh, a little bit of revenge, but the Shockwave is definitely a little bit more uncomfortable than this.
No, fine. So our colleague, Sean, likes to use it a lot.
Does
he
he?
likes to use it after the Shockwave. So when he normally finds that when he uses the Shockwave, it gets a bit tight across the area. So he just uses it to basically loosen up the tissue afterwards.
Fair enough,
It's
sounds
more
good.
of a feel-good factor, I think.
Yeah, personally speaking.
So, practices use these machines?
I mean, I think, I mean, maybe a few years ago, ultrasound and electrotherapy was a little bit more popular. But since the evidence has come out, because the long-term effects are not as good, they don't tend to use these kind of machines. With regards to the Shockwave, because it's shown to be quite effective for kind of tendon issues, it does tend to be a little bit more used. But the price point of buying a machine is a little bit higher, so that's why you might not see it in every kind of private practice.
Yeah, that's fine. Cool. Fine. I think that's it. Carl, anything else?
No.
You need to wipe the gel off your arm.
I do need to wipe the gel. Thanks, Min. But I think that's good for today. If you've got any questions, guys, though, just give us an email on info@londonbackpainclinic or Min.
Oh, sorry. You can just follow us on Instagram or drop a comment in the comment section below. Thanks, guys.